Ladies and gentlemen, welcome to the Lake Superior Quality Innovation Network Motivational Interviewing Basics for Chronic Conditions webinar. Your host for today, Mark Lausch, will now begin.
Thanks so much, Crystal. Hey, good afternoon, everyone, and welcome to the Lake Superior Quality Innovation Network Learning in Action Network presentation on motivational interviewing basics for chronic health conditions. Mia Croyle is going to be our presenter today, and I'll introduce her in just a second. But prior to moving into the presentation, I just want to talk just for a second about continuing education. First of all, thank you for attending our presentation today. We hope you find it as interesting as I believe you will. Metastar, one of our partners in the Lake Superior Quality Innovation Network, is providing continuing education for this presentation. So we need to let you know that no commercial support has been received for this learning activity. The speakers and the planners have reported no conflict of interest. For CE credits or certificate of attendance, you must attend the entire session and complete an online evaluation that will come up. It will come up as you close your browser from this webinar, and it will also be sent to you via your registered email address. You only have to complete the evaluation once, though. Social workers who would like CE credits must complete the online evaluation in addition to a post-test, which is also included in the evaluation. So we encourage everyone to complete the evaluation to provide feedback on the session. So that being said, and again, I'll remind you guys at the end about that. So today for our presenter, we have Mia Croyle. Mia is a behavioral health project specialist with Metastar. She received her master's in clinical mental health counseling from Valparaiso University and has over 10 years experience with motivational interviewing at ESPERT, which is, for those of you that don't know, screening, brief intervention, referral, and treatment. It's a intervention for alcohol and substance use disorder. She is a member of the Motivational Interviewing Network of Trainers and trains motivational interviewing extensively in Wisconsin and beyond. She does a lot of in-person work in Wisconsin and beyond with motivational interviewing. So I'd like to introduce you to our presenter today, Mia Croyle.
Thanks, Mark, and welcome, everybody. Thank you very much for taking an hour out of your day to think and learn with me together a little bit about motivational interviewing. Like Mark said, my background is in clinical mental health counseling, but where I first learned and started using MI was in a primary care context. Since then, I've had the opportunity to use it with groups via some phone coaching and also, some more in the primary care context. And I've also had the opportunity to work with groups using it in a wide variety of settings, so healthcare primarily, but also social service and criminal justice settings as well. So I'm excited to have the chance to help you think a little bit about MI, particularly for the use of helping us with our patients who are dealing with chronic conditions. So after attending this webinar, hopefully you'll feel a little more equipped to identify and talk about what we call the spirit of MI, or that's really just the style or approach, and how it might be the same or different than other approaches to helping others. Think about integrating at least one of our core MI skills, which is reflective listening, and how might you integrate that into your current practice. We're going to do a little bit of practice even on the webinar today. And also I'm going to share with you a few strategies that we might use in MI, so hopefully you would feel comfortable taking and using one of those, putting those into practice, and then thinking about some potential next steps. So if you did decide, hey, this MI stuff sounds useful, how would you continue on the journey knowing that one webinar is definitely not enough, right? So here's my disclaimer. This webinar is not meant to prepare you to deliver this evidence-based practice. There's a strong evidence base with MI, and we hope that you'll gain some improvement just from joining this webinar. And we also know that it really does take more focused attention and learning to really get to the point where you're practicing this evidence-based practice with some fidelity. Learning motivational interviewing is a developmental process, and it really requires more of a long-term investment. And we know from some of the research that people learn best when they have repeated opportunities to practice their skills and get some feedback and coaching on their skill development. So today we're just going to give you a taste of motivational interviewing and hopefully get you interested in taking a bigger bite. So what is this motivational interviewing thing? We often shorthand it by calling it MI, which in the healthcare field can get a little complicated because people think you're talking about some sort of cardiac event. And it also can get a little complicated geographically because MI is also the abbreviation for Michigan. So when we're talking about MI in the motivational interviewing context, we're talking about a collaborative, person-centered guiding method. And it's specifically designed to elicit and strengthen motivation for change. One of the key words in that definition that is pretty packed full of jargon is the elicit piece, right? So a lot of times in healthcare, we think about instilling and strengthening motivation for change. And so motivational interviewing represents a little bit of a shift in our thinking. So what we're working to do instead is draw out as opposed to put in that motivation. So we're looking to identify the other person's motivations. Another or more simpler way of defining it is that it's a framework, and it offers us to structure our conversations with some intention, so that we're creating opportunities for the person we're working with to hear themselves making the arguments for change, to give them a chance to talk themselves into making these healthy and positive changes. There is a pretty robust evidence base for motivational interviewing. If anyone is interested in more of the particular research, I'm happy to share with you lists, reference lists, resource lists, appendices. There's a lot out there. I'm not going to bore most of you with the ins and outs of a lot of the research because I know that's the thing that maybe isn't the most interesting to listen to over your lunch hour. So instead we'll talk about how might this MI stuff, this motivational interviewing, be useful in the context of chronic conditions. So typically with our chronic condition care, we're talking about a wide range of behavior changes that we're hoping the patients that we work with might make, right? A lot of times we want them to make those lifestyle changes of changing their diet, changing their physical activity or exercise level, taking new medications, sticking to what might be for them a challenging and complex medication regimen. We want them to be not only coming back to make appointments with us, but also maybe accessing other specialists and going to other specialty care visits. So we really are asking them to do a whole host of things. For some people that may involve making change, quitting smoking, making changes to their alcohol consumption. Lots of complex behavior changes fall under this umbrella of chronic conditions. And we know as healthcare professionals, we're traditionally trained to promote that behavior change through sharing education, sharing information, and giving advice and recommendations. We also know there is a subset of our patient population who that strategy works really well for. Those patients who are unaware of the recommendations or maybe they're not sure how to go about making some of the changes, that education, information, and advice giving is very useful for them. And we also know, at least it's been my experience, and I would venture to guess you've also probably had some similar experiences, which is there are a portion of your patient population who, even though they know what they're supposed to do, and they know generally how to do it, and they have the resources necessary to make those changes, they're still not making changes. And so that's where MI can really come into play in helping us change our approach in a way that's going to hopefully help those patients identify their motivation for making the changes. So our goals when we're doing motivational interviewing are to identify any individual's internal motivation what's meaningful for them, what might be some motivators for them in terms of making movements toward making some of those lifestyle changes or taking their medication. And then how can we reinforce or sort of further strengthen this motivation? And how do we help them translate that motivation into action or into a plan? So what we're trying to do in the long term in motivational interviewing is focus on, which seems to make sense given the name, but we want to focus our efforts and our energies on that person's motivation, which is often sort of a missing component in our other approaches. So some key concepts and key things that we're trying to achieve in motivational interviewing toward that end is to reduce a person's resistance. So that might be their resistance to the change in general, right? So a lot of times that might be due to the fact that people have very solid, good reasons for not making whatever changes we're proposing. They may not be reasons that resonate with us from sort of our own value set, but there are good reasons, you know, thinking about the context of sodium intake, right? So we can talk to patients all day long about eating a lower sodium diet, and often we will hear back from them, but I just really like the way salty chips taste. You know, and so from our value proposition, that may not be like, well, sure, taste, but your health. And from our weighing it out, we think, well, gosh, you should make the healthy choice. And it's hard to understand that. But when we try to enter it from their worldview, we can recognize that's an important component of why they're not changing. So we have to have some skills around working with that. So we try to show empathy and feel empathy, right? So we try to enter the situation from the other person's perspective or other person's point of view. We really utilize what's called a competency worldview, and so that really looks at focusing on what strengths and what competencies the other person is bringing to the situation at hand. So if they are really having trouble giving up those salty potato chips, we might think about, well, what other things or changes have they been able to make, and how have they been able to do that, and how might we bring some of that success over to the current situation at hand? We also work to reduce that resistance by setting our relationship up in a certain way. So we are very partnering in motivational interviewing, and not just sort of in that in name only, like sort of saying I'm going to be a partner with you, but then really only relying on my own expertise as we navigate through the conversation. It really is about setting up some opportunities at every point in the conversation to create that partnership and that collaboration. And then autonomy talks about really respecting the other person's right to make the changes or not make the changes on the timeline that feels best for them. So really thinking about where is this person at and trying to meet them where they're at and be respectful of, you know, their entire worldview, their values, their experiences, all the things that are contributing to why they're changing and not changing, and recognizing, which is hard for us to do as helping professionals, but really recognizing that the decisions they make are their own. And even though, you know, from our point of view, they may not be the smartest, healthiest decisions, they get to own their decisions, and we can really influence them and work to influence them as best we can. But we don't get to make those decisions for our patients, unfortunately, or fortunately, I guess. We also, a key concept in motivational interviewing is this idea of ambivalence. And so ambivalence is thinking about when a person has not made a change, it's usually because they have arguments on both sides of the equation that feel very valid to them. So they have some substantial arguments for making a change, and they have some substantial arguments for not making a change. And so I envision that as like a teeter-totter, right? And so we've got some stuff sitting on one side of the teeter-totter and some stuff sitting on the other side of the teeter-totter, and they're just going back and forth. And that feeling of sort of being pulled in two directions really captures what we mean when we say ambivalence. And so in motivational interviewing, we work to sort of directly address that ambivalence. We don't want to pretend it's not there or ignore it, because that's when ambivalence can become toxic to the change process, is when it's not directly addressed. A lot of times it can make professionals feel a little nervous to hear some of that ambivalence, because we look at it as a signal that they're not going to change, when in reality ambivalence is just a part of the natural process for most people in most circumstances. Another key concept in motivational interviewing and working in motivational interviewing approach is that we want to develop some discrepancy. So motivational interviewing is at its basis very strength-based, very positive, and where some of the power in motivational interviewing comes from and its ability to move people is in this piece of developing that discrepancy. And so that is where we're helping the person really take stock about where am I right now in relation to, whatever the topic under consideration is, in relation to my weight management. Where am I right now? And where would I like to be? And what's the space in between? So really feeling that discomfort. And discrepancy often is accompanied by a good deal of discomfort. It's not a comfortable thing to think about. And the positive thing is that in the context of a partnering relationship where we've been showing empathy and respecting the other person's autonomy, we can help them experience some of that discomfort in a way that feels safe enough that they can use that discomfort as motivation to move them toward the change. And then the last key concept in motivational interviewing is this idea of wanting to evoke change talk. So a minute ago when I was talking about ambivalence, and we were talking about sort of that teeter-totter, right? So on one side we have the person's own arguments for why that change might be important, and on the other side we have the person's own arguments for why they might not be ready to make a change. And on this side, the first side, where we're thinking about their own arguments for why a change might be beneficial for them, that's what we call change talk. And one of the things we know from the research in motivational interviewing is that change talk is a very powerful predictor of change. And when we hear change talk, there are some specific things that we can do to help further strengthen that change talk and help translate that change talk into action. So thinking about the spirit of motivational interviewing, and we said this is sort of the style or the general approach. Our acronym for that is PACE. So we want to think about these four components of the spirit of motivational interviewing. The first being partnership. So we're really viewing this not as I'm the expert coming in telling you what to do, but we want to think about I'm a companion to this other person along this journey of change. I want to bring whatever expertise I have on the issue and use that to collaborate sort of in an equal relationship with the other person's expertise. Gosh, I might be an expert on diabetes, and I know a lot about managing diabetes care. And the other person is an expert on their own life and their own body, and they know a lot about what would work and what wouldn't work and what has worked in the past and what they haven't tried and what's meaningful and what doesn't feel meaningful at all to them, right? So they have a lot of expertise too, and we work really hard to sort of keep that power differential between us and the patient at an equal level, and to do some specific things to communicate to them that we're valuing and honoring their expertise just as much as our own. The A in PACE stands for acceptance. And so this is where our sort of strength-based approach comes in, right? We want to communicate to the other person that we value them, we just respect them as a human being who is valued in their own right just as an individual. Sometimes we use the term unconditional positive regard to talk about that, and that word comes from sort of the counseling field, but it just talks about, this idea that we're going to hold them in high value no matter what they do. So thinking about it in a little more basic language, it's sort of like unconditional love. Like, I'm going to love you no matter what, no matter how you're behaving in this moment, my love for you is not in question. So thinking about, right, it's not our romantic or familial love that we're having for our patients, but in that same vein, accurate empathy really talks about our efforts to understand the other person's perspective. And when we get to reflective listening, which is one of our skills in motivational interviewing, we'll talk about how we try to demonstrate that accurate empathy for the other person. But really it involves us taking on of their role and their perspective. Affirmations, which is about finding those positive things, those strengths and those successes, and really calling them out, making sure that the other person is recognizing them as much as we are. And supporting their autonomy. We already talked a little bit about that, but that's just really creating opportunities for them throughout our interaction to experience choice and control. This is very important, and I think it's very important in the context of chronic health conditions and partnering with people who are experiencing chronic health conditions, because it is very, very common that they feel a sense of powerlessness in that situation. They're experiencing loss of control because all of a sudden, or for a long time, right, their health is not what they want it to be, and it feels very disempowering for them, for the patient. And so as much as we can help them experience that choice and control, that supports better ownership of their health conditions. It supports more engagement and more active participation in the management of that chronic condition. So we can really use this idea of supporting their autonomy and expanding their experience of choice and control to accomplish the goals that we want, which is that they're taking ownership over managing their health condition. Our C in our PACE, a spirit of motivational interviewing, stands for compassion. And so this is not unfamiliar to us in the healthcare field, right? But this is, we do what we're doing in the interest of the other person's welfare. We do what's in the best interest of the other person, and we really want to prioritize their needs. So we don't do motivational interviewing in the context of sales or promotion, right? We're not trying to accomplish our goals with motivational interviewing. We're using motivational interviewing to help the other person try to accomplish their goals. And hopefully in the context of a compassionate healthcare system, our goals and the patient's goals are aligned. And the E in PACE is for evocation, right? So that just talks about that drawing out of the other person, really working to hear and create opportunities to hear their perspective and their motivation. A lot of times that's, making space for their values and for them to tell us how the situation looks from their point of view. So one particular tool, I told you that throughout the webinar I'm going to be introducing a few strategies to you. So one particular tool that we can use in the area of partnership to really support that idea of partnership is it goes by several different names. In this example that I have on this slide, it's called a visual behavioral menu. More commonly, we call this agenda setting or agenda mapping. And, often what I'll hear in common usage is the highly technical term, the bubble sheet or the circle sheet, right? Because at its most basic, what it consists of is some circles on a page. This is a really nice way to make visible and to make tangible our sharing of the agenda with the other person. So we could use this in a lot of different contexts, and it's a very flexible tool, so you can use it in a lot of different ways. The example that's up on the page, as you'll see, the context of that is for pediatric obesity prevention. So the idea would be that if I was a health coach, for example, and I was going to be meeting with a family, a parent and a child, to talk about some things that we could do to promote a healthy weight for the child, I might have this filled out, or I might fill it out in a moment, and at the beginning of our time together, I would introduce the agenda to say, I wonder if to get started, we could look at this menu example, and you'll see I have some bubbles filled out already, and some of them are still blank. The ones I have filled out have some of the things that I commonly talk to families about, and so those are things like sleep, fruits and vegetable intake, physical activity, screen time, and sugar-sweetened beverages. Now, you'll notice there are some empty spots, and that's where I really want to hear from you. What do you think it's important that we get on our agenda and make sure that we have marked down that we're going to cover in our time together as well? And then I would, hear what the person had to say, make sure to fill it in, and then when all the bubbles are filled in, or when they've said every one of their ideas, right, there may still be some open bubbles, then I could again turn to the other person and say, okay, so given all those, where do you want to start today? Or if I know there's one that I want to start with, I might say, which one circle do you think it's most important that we make sure we hit on today? Well, some of these we'll have to get in our follow-up appointments, but which one do you think is most important to talk about today? And we may or may not start with that one, but at least giving them the opportunity to give voice to their priorities for the visit. So it's a really nice tool that we can use to just share the agenda, which then promotes that idea of partnership and sharing our expertise. It also allows them very early on in our interaction with them to experience choice and control. Right? So they have some control over what we talk about. They have some control over when we talk about which topics, right? And they get to make some choices as well. Now, a couple things I want to point out about this particular example that's on the slide. You may have noticed when I verbally introduced this example, I wasn't quite as prescriptive as what's written on the slide. So it says get enough sleep, and when I was just verbally introducing it, I said we might talk about sleep. Now, my suggestion is to just be as general as possible in those bubbles. So I don't like the fact that looking at these bubbles as a mom, if I am looking at this, there's already 5 to-dos on my list. It's already very prescriptive and very directive about what I'm supposed to be doing versus opening up a conversation. Now, certainly, in the context of that conversation, I, as a healthcare professional, might recommend that the person, for example, increase their physical activity or their child's physical activity. But I don't want to lead with that. I want to start with it being a little more general. So in my bubbles, if I filled it out, I might just say physical activity. The other thing that's not ideal about this particular example, and I put this example up on purpose so you can see some of the not so great things, is just the balance, right? So I've got 5 already filled in and I'm giving them 3. I would suggest that if you're going to use this tool, think about having it be equal numbers. Either, I have 4 and they have 4, or, or giving them 1 more. So if there's 9 on the page, I would take 4, leave 5 blank. It's fine to continue with a blank 1 or 2 left on your agenda, not filled in. So a couple ways that this tool could be very flexibly used is in the idea of a short visit. I might have 2 bubbles or 3 bubbles and say, put my one thing that I want to make sure to follow up with them on in my bubble, and then ask them their one thing. And then that allows us to, at least right at the very beginning, check in. one of the nice things this does is it decreases those sort of doorknob questions as I've got my hand on the door and I'm trying to get out of the exam room into my next patient, and then their real agenda comes up. And then I have to, come back in and delay my day and all that, right? So this gives them an opportunity to offer up their agenda items right from the get-go, right from the very beginning. The other thing, nice adaptation that I've seen made of this is having some filled in with just pictures. So for a younger population, an older geriatric or dementia maybe population, or a population where we just have a suspicion that there might not be a high level of literacy, we might, have a little man running in the physical activity, a little jogging icon. We might have a cola can in the sugar-sweetened beverages. We might have, just a little TV screen in the screen time bubble, right? So you can think about how you could use this tool and how you could shape it for your particular visit and your particular population. It's very flexible. So one of the key concepts that we talked about early on in motivational interviewing is change talk, right? So that's the other person's own arguments for change. And one of the things we have to do in getting ready to work in a more MI way is sort of train our ears to all the different ways that change talk might come up. So here's some examples, and as you'll see, some of these examples seem a little more concrete and a little more urgent than others. And that is all fine. It all falls into the area of change talk, right? So it could be, if I felt better, I could watch my grandkids. Right? Those are all kind of hypothetical and not super urgent, but it does give us a clue as to what this individual, what might be motivating for them. And a follow-up to a statement like that I might want to ask is something like, tell me, what kinds of things might you want to do with your grandkids? Or have there been some examples of wanting to do some things with your grandkids where when you just weren't able to do them? Tell me more about that, right? I'm tired of feeling so sick all the time, right? So that one, again, it's not directly linked to action. There's obviously some interim steps in between, but this is an idea that there is some motivation there. This person is expressing to you that they're not happy with the way things are right now. If I took my pills, I might feel better, right? They're having some hope for a potentially better future state. I wish I could lose weight, right? This is still, again, it's kind of in that desire category of change talk, where we talk about, often it's hypothetical, but there is a desire out there, and so we want to attend to that and see if we can't translate that desire into commitment and then into action. I have to quit smoking before I go on oxygen, right? So that one's a little more concrete. It's got a little more urgency attached. I know I could find more ways to be active, right? So that talks about the person has confidence in their ability to do it. Maybe they're not doing it because they're not sure that being active is going to make any positive changes. So I might explore with them, how might being more active benefit you, right? What are their thoughts about that? The dietitian might help me get on track. Right? Or I want to be alive to watch my kids grow up. Right? This is telling you sort of what some of that person's motivation is. I suppose I could eat a salad for lunch. Right? Again, change talk shows up in all sorts of varieties, and we just have to really start zeroing in on listening for it and asking for it. And so our skills help us with some of that asking, right? Our four main skills in motivational interviewing, and if you go to sort of a motivational interviewing beginner workshop or even look at some of the tools that are available online, you'll see reference to the ORs, right? So these are our four main skills. Sometimes they're called the micro skills in motivational interviewing. So open-ended questions, those are questions that ask for more than just a yes or a no or a one-word response. Affirmations, and like I said, that's just really highlighting a strength or a value in action that you see and calling that out. Reflective listening, that's reflecting back, sort of mirroring the other person's statement to show empathy and encourage them to continue talking in that direction. And summaries. And that's where we sort of summarize what we've heard so far, and often it's used as a transition or a pivot point into a new activity in our conversations, or sort of a new topic. And we're going to focus today on that reflective listening. We don't have time in a 1-hour webinar to get to all of these. So for me, from my point of view as a trainer in motivational interviewing, reflective listening is the one that is least sort of naturally occurring. It's probably the one you're least inclined to do just on a natural basis. And some of the preliminary research is telling us that the ratios that link how much reflective listening you're doing to anything else, particularly that question to reflection ratio, is most closely linked to improved outcomes. So if we can increase our skillfulness in reflective listening, the research is strongly suggesting that it's going to have some benefits in terms of your patient's outcomes. So reflective listening really, like I said, mirrors back what the other person said or what they might have meant. It encourages the other person to say more. It really can be a conversation facilitator. And we can shape the direction of the conversation very intentionally by what we choose to reflect. So we're going to do an example, and then we're going to do a couple practice rounds. So practicing on a webinar is always a little challenging, but I think we will give it a go. So here's an example. This is obviously a patient statement. I don't think you understand. I don't have any more sick time, so I can't be going to all these appointments. I'm feeling fine now, and I have the pills, so I don't see why the doctor can't just call me in more refills, right? This may be something you've heard before in your practice, right? So some potential reflections to that statement, right? So a simple reflection might be to just reflect back some of what the person said. You're having a hard time knowing that I understand your situation, right? Or some other ones that are listed here on the side, right? You're frustrated. This is really hard. Coming in for appointments is challenging. You're struggling to fit your appointments into your work schedule. Now that you're feeling better, this doesn't seem as urgent. You wish there was an easier way. Or it doesn't make sense to you why the doctor wants to see you before refilling this prescription. Okay? Our impulse, and this may not have been your impulse, but generally speaking, our impulse in healthcare, when we hear a statement like this patient statement, I don't think you understand, I don't see why the doctor can't just call me in more refills, is number one, to feel a little bit defensive, right? And number two, to start informing the patient. Let me tell them why the doctor can't just call them in more refills, right? There may be a place in our response to this patient statement for some education around why it's important to come in for a visit. And for the most part, a patient who says a statement like this is not yet ready to hear the actual rationale for why the doctor can't. They're not really genuinely asking, how come the doctor can't just call me in refills? I'm curious. They're saying something else. And so what we try to do with our reflective listening is reflect back what they're saying. That shows empathy for their experience. It helps us stay connected. It helps them feel heard and understood, which is generally one of people's primary needs, is to feel understood. And it then connects us in a way that we can go on after we've offered some reflective listening to that next step. Okay? So I often tell people you don't have to let go of your response, but what I encourage people to think about is, can I reflect first and then respond? So it sort of adds a beat in there, and it feels for some people, I know, like a time waster. But what we've found is that when you have an effective partnership with the other person, when you have what we call like a positive working alliance with them, they're more likely to make changes. So it's not a time waster. It's just in service of a different goal than what we've typically been thinking about. So I have a couple more practice samples. So what I'm going to have you do, let's see if we can do some group practice with over 100 people on the line. I know some of you are probably listening in groups at your location, so feel free to just do this with your small group. But I'm also going to invite you to pop open your chat box, and as I read this statement, think about a reflective listening statement that you might offer back to a patient who says something like this. It's no fun sticking to that low-sodium diet. I can't eat anything I like, especially at restaurants. So yeah, sometimes I guess I end up eating more sodium than the doctor said I should. So take a minute now on the call. I see some of you have already started to offer some reflective listening statements of what you think a reflection might look like or sound like. Great. So if you're still typing them in, go ahead. The typing in is not for my benefit, it's for your own. So I'm going to encourage you to keep trying to come up with your own reflective listening statement. I'm going to read out a few that I see here in the chat box. It's tough to find low sodium options when you eat out. It's difficult to find something you like to eat when you're at a restaurant. It sounds like you're worried about not being able to eat out, which you enjoy. I understand that following this diet is hard. Okay? It's really difficult to find something good to eat, especially eating out. Sounds like you're really missing the salt in your diet. That does sound tough. It's hard changing things that you've always done. Following a diet can be hard. You guys are getting this. Perfect. So, you know, our impulse maybe is to say, hey, I have this guide of, you know, low sodium options at lots of common restaurants. Could I share it with you? Or, you know, it's going to be worth it in the end, because what happens when, you know what happens and how hard it is on your system when you get all that swelling after you've eaten too much salt, or, you know, tisk, tisk, tisk. It's our impulses to just start educating and informing and supporting and helping. And there's nothing wrong with all those things, but for the patients, it can be really nice to just get that reflection to show that you understand. A couple pointers that I'll offer just to the group as a whole. Number one, if you think about offering reflective listening without what we call introductory clauses. Right? So a lot of times when we're first starting with our reflective listening, we want to say, sounds like, or a common one that I didn't see typed in here is, what I think I hear you saying is, right? And those are fine. There's nothing wrong with those, other than if you're doing a good volume, if you're doing a lot of reflective listening, it starts to sound really repetitive. And that's when patients feel like you're doing something gimmicky or techniquey with them versus just listening to them, right, and reflecting back. So when you're doing reflective listening, you don't need to say, I understand that, blah, 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 or it sounds like blah, blah, blah. You can just start your reflections with you or that or it, right? Without those introductory clauses, it helps it feel a little more conversational, which is our ultimate goal. And again, I think about those introductory clauses as sort of like starter blocks that if you were running track, right, they help us get launched. And so if it feels more comfortable for you while you're first practicing using those starter blocks, don't stress too much about it, but if you already start to feel a little comfortable offering those reflective listening statements, that might be a way to sort of take it up a notch and just work on ditching some of those to get a little more conversational feel. So we're going to do one more, another statement, and again, just like last time, pop them in the chat box, or if you're there with a group, you can say them out loud to the group. But I'm just going to encourage everybody to think about actively responding to this with a reflection as opposed to listening and waiting and just hearing other people's reflections. So the statement is this: I can take those water pills fine on most days, but on days when I'm going to be out and about and I can't trust that I'm going to be able to find a bathroom in time, so then I just skip my pills those days. All right, you guys are fast learners. See, in the second example, I don't see any of the sound lights or anything. So you're worried about being able to make it to the bathroom when you need it. It's inconvenient to take your water pills on some days. It's hard to find a bathroom in an urgent situation. Taking water pills is very inconvenient. You're afraid to take your pills if you may not be able to find a bathroom. Most of the time, you're able to manage taking your water pills. That's a nice one that sort of looks for the strength, right? So the person's saying most days I can take it, but there's these rare days. So we're really trained to look at sort of where's the person failing, but that's a nice reflection that sort of focuses on the days when they're succeeding. You're concerned about the water pills negatively impacting your ability to go out, and they create anxiety about finding a bathroom. It can be hard to find a bathroom, right? Sometimes those short and sweet reflections are really powerful. And our goal with our reflective listening is to encourage the other person to keep talking, right? So that's a really nice one to just, sometimes our reflections don't have to be super long and complicated. They certainly don't have to capture everything that the other person said, right? We want to be thinking about what's going to be useful to move us forward. Reflect that with the idea that that piece is going to help us continue moving forward. What you reflect is most likely what the other person is going to continue to talk about. You're worried about having to take your pills and go out. Your dignity is important to you. Really nice finding the person's value that's unspoken in here but is clearly there. So if you wanted the person to say a little more about their success of taking the water pills on most days, you might reflect that. On most days, you're able to take your water pills. If you want to hear more about their anxiety and skipping the pills, you might say you skip your water pills on some days, right? And then they're going to say, well, yes, usually it's just on Tuesdays when I go to do my grocery shopping and get my hair done, right? Or maybe they, if you want to hear a little more about what they've done about the bathroom situation, you could reflect that piece. So what you reflect is really going to shape the direction of what the person says next in the conversation. So this is one of the more gentler ways but more powerful ways that we can guide the conversation toward useful change, toward what we call that change talk, toward their arguments for making a change, without just sort of redirecting them in a more active or sort of hands-on or bossy, right, way. This way we're showing that we're listening to them, we're hearing them, and we're sort of encouraging them to keep talking in the areas that, from our point of view, seem most fruitful. So when we hear change talk, we definitely want to reflect it. That's one of the great ways that we help maximize the impact of that change talk on the individual. We want to hear more about it. We want to get them to expand on it and go deeper and wider and list more about it. We really want to explore that change talk. When it doesn't just naturally show up in conversation, then we have to do some things to evoke it or to ask for it, to get it to show up, right? So we use mostly questions as that strategy to evoke the change talk. So potentially we might say something like, what are some of your concerns about your congestive heart failure? Or if they're not managing their condition pretty well, we could say, what might be the worst thing that could happen if things continue as they are? Or we could ask, how might making a change be beneficial for you? Okay. Generally, again, what we're trained to do and what we're sort of primed and ready to do at a moment's notice is tell them some of our concerns about their condition, tell them the worst thing that could happen if they don't make those changes. If you don't get your blood pressure under control, you could have a stroke, right? Or we might tell them how those changes are going to be beneficial. Losing some weight will really help, blah, 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 and blah, 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 and blah, 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 right? And this isn't, again, it's not to say that there isn't a place in the whole process for us doing some of that informing and educating, but we want to first try and get it to come out of the other person's mouth, because from their mouth, it's so much more powerful than from ours. So asking some of those questions to evoke that change talk. And when we are in a position where we want to share some education, advice, information, maybe some suggestions, here's a strategy we can use that helps us remain in that MI style, that MI approach, and still do that sharing information piece. So sometimes these have slightly different names for the 3 steps in the process, but it's always a 3-step process, right? Explore, offer, explore. Sometimes it's called ask, tell, ask, or elicit, provide, elicit. And as you can see, those 3 steps are still the same no matter what they're called. So the first explore is really where we're going to ask the other person, tell me, what do you know about benefits to weight loss in the context of diabetes, right? What do you know about why it's suggested that people with this diagnosis lose some weight or make changes to their diet or eat less sodium or have more fruits and vegetables, whatever it is, right? We ask them to tell us their existing knowledge. We also want to explore what they're interested in. What might it feel useful for you to hear some more about in terms of diet change and diabetes? Or we want to get their permission. Would it be okay if I tell you a little bit about why diet changes are such a common recommendation that we make for patients who have diabetes? Okay. So then, after assuming we get their permission, and most people will just give you their permission, but if they don't, you want to respect that. But assuming we have their permission, then we want to offer it, right? So we want to do it in a way that still holds them as the expert. We want to share that information in small bits, avoid jargon. If we're offering suggestions, it's generally advised to offer a menu of options as opposed to one suggestion, right? You should do this. It's generally better to, people could do this. I've seen people have success with this, this, or this, right? And then the third step in our process is that last explore. So we want to check out what are their reactions to that information. What ideas might that generate for them? What are they thinking in terms of next steps? And what questions might they have? Generally, what I've seen and what I've done and what I've experienced on the other end as a patient is that all that happens in that last explore bucket is, so what questions do you have? Or even, do you have any questions? And what my experience has been is that generally people, especially if it's new information or information that is challenging to them in some way, they're not ready yet at that moment to formulate questions. They might have some reactions first. So often I'll say something like, given that, where does that leave you? What are your thoughts about the information I just shared? Before I go into what questions do you have, right? So we want to, because that in that second explore is really where they're applying that knowledge and processing it and making sense of it. And, you know, it's just like a brochure. I can hand somebody a brochure, but if they don't open it up and read it and try to make sense of it, it's not going to do any good. So the same thing as our offering of information. If they're not doing something active with the information, if they're not responding and reacting to it in some way in their processing, it's less likely to stick. It's less likely to be useful information for them. So there are a lot of resources. We're nearing the end of our time. There are a lot of resources in the area of motivational interviewing. The Motivational Interviewing Network of Trainers is an organization of trainers who have sort of self-selected to get ongoing training and support and gone through a training new trainers process and gotten some, you know, best practices in terms of spreading the practice of MI. Through membership in that organization, people have access to all the latest and greatest innovations in terms of training MI, in terms of what the research is telling us. So it's a very active group. And so one way, if you're thinking, gosh, I want to bring some more MI training to my workplace or into my life, I want to access some things. One potential way to ascertain, am I getting good information or not, is to think about, is the expert who's bringing me the motivational interviewing a member of this group? If not, I mean, it's not exclusive, right? So if they're not a member of this group, then some questions to ask really to evaluate, is this person going to be a useful resource to me in my journey, is, you know, how are they keeping current in innovations in MI? How do they make sure that they're training in best practice ways? And, you know, asking them a little bit about what do you do to make sure that you're training people and helping people achieve fidelity to this evidence-based model. There's one main publisher that publishes most of the books in motivational interviewing, so that's Guilford Press. There's no reason you should purchase directly from them or not, but they do have very nicely on their website a page that just lists applications. They have a series called Applications of Motivational Interviewing, and in that series there's, like, for example, MI in diabetes care, there's MI for fitness and nutrition, there is an MI in motivational interviewing in healthcare book. There's a very nice building motivational interviewing skills workbook. So if you just want to know sort of what's out there, that's a good place to at least start in terms of in terms of book resources. And there are a lot of online resources as well. That if you're looking for a resource in a particular area, I'm more than happy to share those with you. You have my contact information at the end of the slides. So in summary, we talked about sort of the spirit of motivational interviewing and how we try to use a style that conveys that partnership, evocation, acceptance, and compassion. Using some strategies like that agenda sharing or the explore strategy for sharing information help us establish partnership and invite the patient to be an active member of the team that's working on caring for their chronic condition. We focused a little bit on change talks and thought about change talk as defined as the patient making their own arguments for change, and we focused briefly on what do you do with change talk when it shows up, which is we try to reflect it, and how do we ask for it when it's not showing up. So we looked at a few questions that could help us get some movement in that area. And we talked a little bit about how learning motivational interviewing is a developmental process, and it's going to require more of an investment of time and effort if you really want to get to that point, and shared some resources about learning more about motivational interviewing. We are almost at time, but if you have questions, you can feel free to contact me. You can pop them in the chat box right now, and I can try to field them. Or, Crystal, if you want, I know we only have 1 minute left, but if you could just share, I'll leave the line open for a few minutes if folks want to ask questions on the line.
Ladies and gentlemen, at this time, if you would like to ask a question, please press the number 1 key. Once again, if you would like to ask a question, please press the number 1 key.
Okay. Hi, Mia. This is Mark again. As we're waiting for questions, I just want to remind everybody to thank you all for attending our Learning in Action Network event today with Mia. Mia, you did an awesome job, and you definitely talked me into using you again to do another webinar. So thank you. And I just want to remind you guys about continuing education for social work and nursing. As you close your link, you will be sent to, as you close your browser, you'll be sent to the evaluation which you must do in order to receive continuing education. For social workers, we have the added pleasure of doing a post-test that will also be attached to the evaluation. So the link will also be sent to your email address, but you only have to do it one time. So if you for whatever reason if you're gone or you have to leave in a quick period of time, it will be sent to you by your email address. When you close your browser, you can choose to do it at that point in time, but you only have to do it one time. So thank you again, Mia, for your lovely presentation today. I certainly learned a lot, and I'm sure everyone else did, and we thank you all for participating with the Lake Superior Quality Innovation Network.
Thank you. We have no questions.
Thank you.
Thank you. So we will conclude our webinar.
This now concludes your call. You may disconnect at this time.